Mm. Good evening, everyone. How are you all? Let's just first confirm if you guys are able to hear me.
Yes, we can hear you.
Brilliant. All right. So thank you, everyone. I'm Dr. Arshan Ahmed, and I am the main mentors for your first aid AMC clinical preparation. So many of you know about first aid. I'm sure about it. And many of you are our MCQ student, or you might have just passed a few days ago. I just found that November exam result for MCQ has been published, I think last night or yesterday. So maybe some of you just passed your exam. Maybe you are in the middle of your preparation, or maybe you are just at the peak of your preparation and you just want to have a little bit of an idea how to make it better. So whatever your position is, First Aid AMC Clinical is here to help you to pass your exam in your first attempt. So first of all, let me introduce myself. So as I mentioned, I'm Dr. Arshan, and I have been mentoring AMC, MCQ, and clinical exam candidates for the last 8 years. And if you know about first aid, you know that how our students pass the exam in the first attempt, both MCQ and clinical. There's a lot of students that we have taught the ways of passing the exam throughout these 8 years. And when students come to us and they are always overwhelmed, anxious, stressed about how this is going to be, but with a couple of months of preparation, we see the difference in them. We see how much confidence they have achieved through the course. And when they go for the exam, we can understand that, yes, this candidate is ready to pass the exam. Just by how they are doing the role play, I can understand that this is a candidate who is going to pass. And that always happens. I've never seen a candidate fail the exam who does better in role play in our course. So I have a good experience in Australian health system. I have passed my MCQ and clinical exam in the first attempt. And you might know that I passed my exam back in 2017, which is a long time if I remember now. And that time it was the same face-to-face exam. And although AMC has changed a lot throughout these years, the mode of exam, the way they take the exam hasn't changed. It is still the same. And I passed my exam with 14 stations. So all of my stations I passed in my first attempt. And that's one of the way to say that, yes, you are in the right hand. I have experience in both general practice. I have experience in Australian hospital system. So everywhere I have made sure that I have some experience so that I can guide IMGs in the right direction. And we have been doing that for a long, long time with pride and honor, because when we see our students are passing the exam in the first attempt, especially when I see the clinical exam candidates are passing, I really feel proud because this is one of the hardest exam that you are going to ever go for. And you know that the passing rate for AMC clinical is not the best, but still our candidates manage to pass the exam without any difficulty because we make them in that way. We make them prepare in a very solid, structured way so that any kind of case that comes in front of them, they will not they will not feel that they have never done this case. They will always have some kind of ideas, some kind of a structure in their mind, how to manage that station. And in a 5 months course that we actually go for in here, 5 months is a long time to give you everything that is needed to prepare the exam. There are courses where you'll find out the course is just for 2 months. There are courses which is not gonna give you everything that you need to pass the exam. But the first aid is designed in a way that it's everything is there. Once you enter into the course has everything that anyone need to prepare for this exam. You don't need any book, you don't need any other notes, nothing. When I prepare notes, and we have been changing our notes, especially in this last couple of years. The guideline has changed a lot. The AMC examiners has changed their way of thinking a lot. So for the last 1 or 2 years, I have changed our notes a lot. It has evolved in a way that it maintains that integrity, it maintains that updated guidelines examiners are looking for. So if any of you have done our course, let's say 3, 4 years ago, and you do it now, you will see the difference, like how much change we have done just in the course structure and also especially the course notes. So the notes are all updated in a very, very detailed way. That's gonna be the only thing that you will need to prepare for this exam. So the main thing for AMC clinical exam preparation is that a person or a candidate needs to know that how to approach a particular case, how to manage the time in that 8 minute station, and how to make sure that everything that the examiner is looking for, you are covering those. So when you have that structure in your mind, you will not fail any case in the exam. Now, let me start one by one. Tonight's session, I have divided it into two parts. The first part is an introduction to AMC Clinical, where I'm going to discuss each and every aspect of clinical exam, like what examiners are looking for, what are the way of giving the task in the exam, how to think when you actually see a question in your exam. So the first part is going to be just focused on your preparation. And the second part, if we get some time, I'm going to just start the basic of psychiatry today to show you that how we take our classes. But you might be aware that the first aid always offers 2 weeks of free sessions. So tonight is just a trial class, just simple introduction, that's it. But the 2 weeks free session, which will start from 7th of January, that's going to be the most important sessions that you guys should attend. You will understand a lot about clinical cases. You'll understand how to start your preparation, everything in those 2 weeks. Okay? Now, the schedules of those 2 weeks classes will be given in our First Aid AMC clinical group, where you'll be able to see all the subjects and topic we are going to cover. So the first thing I want to say to you that I'm really glad that you guys are here because this is the first step that hundreds of successful IMGs have taken. And this is the first step that they have taken before they passed their exam and they started working as a doctor in Australia. Remember that this is not just a trial class. It's I like to say that it is the beginning of your journey towards becoming a doctor in Australia. So every single one of you have already worked really hard, especially even to think of being a doctor in Australia is expensive, I'm sure, right? So you have already done the 50% of it. You passed your MCQ. Some of you might have already passed your English test. So you are halfway through it. I know that it can be really overwhelming in long hours of studying, family responsibilities, sacrificing a lot of time. So, and the constant worry that if you are going to pass this clinical exam, right? So these are always a difficult time. And I always advise my students that it is not impossible to pass AMC clinical exam. Especially if you look at our first aid group, you will be able to see that every month a huge amount of students are passing from the course. Every month, more than 10 students pass. And you might think 10 students are not good in comparison to MCQ. In MCQ, we get like 30, 40 students passing every month. But you have to also understand that not a lot of students pass clinical exam. So if 10 students pass, I'm really happy with that number because that's a big amount. So remember, students do not pass clinical exam by luck. There is no luck in here. They only pass because they do a lot of hard work, they have the right structure, right guidance, and they do a lot of practice. And that's why our students pass the exam, because they know what to read, what to practice. They know the right structure in front of them. In first aid AMC clinical preparation, all of our mentors are currently working in Australia. Every one of them works as registrar and above level. There is no junior doctors who teach here. So all of our mentors are at least a registrar who is working in Australia. So they are well structured with this Australian health system. They know each and everything that an examiner is looking for, and they know the guideline each and out of it because we are practicing it every day in our practice. Remember, the course is not about drowning you with lots of random cases. We just don't ask you to do a random case and ask you to read 300 cases and then just memorize those cases. I am going to do the theory classes with you. So all the theory sessions that you will get will be with me. And other mentors usually do the role play classes with you. So how I'm going to prepare you for the baseline that you need to achieve, that's going to be well structured. I always have a structure in place to make sure that you have a set amount of questions in your head. If you see a case with chest pain, you will know how to approach that. You will not just ask questions randomly. You will know there are students who start with chest pain questions, and after that, in the middle, there is nothing else, no differential diagnosis, nothing. And then they ask about smoking, alcohol, past medical history, family history, and they're done. So there has to be a structure in your mind, and all the basic cages that always comes in exam, I always put them in a concise, structured way. So we follow the cluster-based approach, and each of the subjects that we are going to cover, especially subject-wise, like let's say we're talking about medicine, we divide medicine into multiple different topics, cardiology, respiratory, GIT, like that. And then the cardiology topics are again divided into multiple clusters. Like we have chest pain clusters, syncope clusters. We will have palpitation cluster, right? Hypertension cluster. So multiple clusters are there. And a lot of questions will go into that cluster so that with only one history, you will be able to cover 10 cages. Like under chest pain, there are at least 8 to 9 cages. And we do that chest pain cluster in a format. And all those 9 cages will fall under that format. So what happens in this way that you don't need to memorize or you don't need to cover a lot of cages randomly. We do it in a structured way so that it's easy to remember. And it's not something like I ask you to do. This is how all the Australian doctors also do this because they always also have a structure in their head when we are asking questions in real life to a patient. Okay? So what we do that we build your exam brain step by step. Your exam brain will be set first how to approach a station, how to communicate like an Australian doctor. I always mention to students that you don't need to be an Australian to pass this exam. You don't need an accent of an Australian person. As long as you're clear, as long as the other person, the role player can understand what you're saying, you are fine. I have seen terrible accent, terrible English from students, but I have seen them passing the exam also because they are slow and the other person understand them. So there is no problem with communication as long as you can make the role player understand you. So you can't be too fast and you can't be too slow because if you're too slow, you will run out of time. So With our course, we will give you that idea that how to communicate better, how to manage time by not being too fast or not being too slow in the exam. Okay? And we will always give you that how to find out the key steps in a case, how to avoid some of the red flags, how to be a safe doctor to work as a doctor in Australia. When an examiner listen to you, one of the most important thing they want to know that is this candidate a safe candidate who can work in Australia? Because if that examiner pass you, you are going to start working as a doctor in Australia. You're going to be a colleague of him or her. So when we do that, when we pass an exam, like when an examiner going to pass a candidate, he or she will want that kind of that kind of ideas that yes, this candidate is right to work in Australia. And how they do that is, are you a safe doctor? This exam is not for a specialist. Please be very careful to understand it because you might be obstetrician, you might be a neurologist in your country, but in here, when you are going for AMC clinical exam, you are just a junior doctor. You think like a junior doctor, and you need to make sure that you be a safe doctor by asking help from your seniors. So you need to make sure that you are not going to, as a junior medical officer, you're not going to treat a acute myocardial infarction just by yourself. You're going to take help from your senior. You're going to take help from a cardiologist. You're going to take help from every seniors that you can possibly have. If a candidate just say that I'm going to manage the MI by myself, I'm going to take the patient to the catheter lab, I'm going to put the patient into a stent, that is the time definitely you're going to fail the case. So it's not about how good you are as a doctor, it's about how safe you are as a doctor to pass this exam. So safety is must. The second thing is that are you taking care of this patient as a doctor? Are you showing empathy to someone who just found out that he or she got a cancer? So empathy and approach brings a lot into your exam mark. If you can't show that in your voice, in your posture, in your way of talking, you will never pass the exam. Whatever, like if you do everything right in the exam, but your voice or your tone is not giving that empathy to someone who needs, they will not, they will not pass you in the exam. Okay? So it's really important to get these ideas in your head because I see a lot of good students fail the exam because when they're going for first time, they feel like they need to cover everything. They need to finish the task and they need to be very straightforward. They forget the essence of being a doctor. The essence is always the kindness, the patience that you have when you talk to a person, when you talk to your patient in real life, you show that kindness, you show that empathy. And in your exam scenario, because you know that these are simulated patient, these are not real patient, so you forget that important aspect that is what make you a doctor, right? So an examiner will always look into that. And if you can't show it in your exam, you will not pass the exam. So tonight is not about making you perfect. In here, tonight is about understanding what you need to achieve, what you need to understand to start your preparation for AMC Clinical. So once you start the course, within a few weeks, you will notice some difference in your way of approach. Your history taking should become more and more sharp. You will start thinking logically, your confidence should improve, and your way of talking should improve. And you will stop panicking because you know exactly what an examiner is looking for. So the course is going to allow you to gather those experience so that you can understand how to be confident in front of the examiner, how to make sure that you can manage everything in that 8 minute time. So I want you to understand. that how we as a course mentor think, how we break down the cages, and how we teach you to think like an examiner. So tonight is about that. Tonight is about understanding AMC clinical and getting a clarity of how to start your preparation. Also, it's important to know that you just don't do a course to pass the exam. This is something that's going to change your life forever, your family's life, your children's life, and your career. This exam is the final hurdle, final step of your dream to become a doctor. So, when something is like that important, you need to also give that much time in this preparation. If you can give the right amount of time, right amount of right amount of sacrifice, then you should pass this exam. So let's not talk a lot. Let's start with the AMC clinical introduction today. If you guys have any questions, you can always unmute yourself and ask me, or you can write it in the chat box. So this is the Melbourne Exam Center. If you have already appeared exam once, you know how this looks like. But if you have never appeared, then this is something new for you. So now you already know that you have a AMC candidate number, and when you are ready, you'll be able to appear the exam. Nowadays, there is only face-to-face exam. There is no online exam next year as well. So I haven't seen any online exam. I'm not sure if they're going to give any more online exam or not, but sometimes there might be a little bit of online exam in between, but overseas students will not get online exam. Okay, so prepare for face-to-face exam. And as part of face-to-face exam, it's important to know that it's difficult to prepare for AMC clinical, but it's also difficult even to get a seat in the exam. There are lots of our previous students who is waiting to even appear the exam because getting an exam seat is not easy. There is only few spots every month. So, and it gets filled like within a second. So in amc.org.au, the official AMC website, when you go to the clinical exam dates, you will be able to see that for the next year, they usually open 3 months exam at a time. So you'll see February, March, April, these 3 months exam dates there. And, and then you'll find out that when the exam will be opened for registration. So make sure to keep that date in your mind because on that date, when you are ready to appear the exam, you need to, first of all, you need to register for the exam. And remember that this is one of the hardest thing to even get into the exam because the day the exam will be open for registration, just within 1 to 2 minutes, all the exam seat will be finished. So you'll need to sit in front of your computer and make sure that be as fast as you can register for the exam. Okay, because that is a real challenge. So once you get your exam date and you register for the exam, the day of exam, this is where you're going to go. So in Melbourne, that is the only exam center for AMC clinical exam so far. I believe they're doing another center probably in Perth, which is in Western Australia, but I'm not quite sure when they're going to open that. But this is the only one currently there. So when you go to the exam center, inside will be similar like this. So you'll be able to sit on a sofa and then they will introduce yourself and then they will give you a locker to keep your belongings. You'll not be able to take anything in the exam hall. Only thing that is allowed is your stethoscope. No watch, nothing. You don't need to wear apron for the exam. Just be casually dressed. You don't need to wear suit as well. Just a casual dress like this for male or for female, just a casual office dress is all that you will need. Okay? So no watch because if you take the watch, that's going to be in your locker anyway. Once the time is there up, then they will take you into a room where they will give a brief about the exam. And each of you, usually there are 16 students in that exam, each of you will be given a card, and the card will have your first station number on it. The first station number, so maybe one of you will be 16 station. Number 16 is your first station. Someone will start with number 1 station. So once the time is up, each one of you will be standing in front of your first station. So there are 16 stations in the exam. And along with the 16 stations, there are 4 more break stations. So 16 plus 4, 20 stations are there. So many of you might be standing in front of the break station. So when you stand in front of that each different station or room, this is how it will look like. Outside, there will be a monitor like this where the exam question or the stem will be written. So there will be a bell, and the first bell will indicate that your time has started for that particular station. Each station is 10 minutes. In the outside, you get 2 minutes to read a case. And in that 2 minute time, you'll be able to know what is the case, like 16-year-old patient coming to you with amenorrhea. And then there will be multiple tasks that take history from the patient, ask for physical examination from examiner, give diagnosis and differential. So there will be multiple tasks, and you are supposed to remember those tasks. So in that 2 minute time, you are going to read the station and you're going to brainstorm that what you are going to ask in this patient. Once 2 minutes is up, there will be another bell indicating that now it is the time for you to go into the station. So once you open the room, there will be an examiner in front of that room who is going to greet you. The examiner will also ask you to show your identification card. So you will always get an identification card which you will hang around your neck, and that card you need to show it to the examiner. Once you show it to the examiner, and examiner make sure you are the right candidate for this station, examiner will say, "This is your patient, Sam, you can start your task." So then you go in, and then there are multiple settings in the station. So sometimes it could be the patient is lying on a couch or a bed. Sometimes it might be like the role player is sitting on a chair. So there will be multiple different way of the stations are going to be. Okay. So once once you go in, you are supposed to start your case. So first you introduce yourself and then you go on with your history and everything else. Now remember this, that your time is running in here. So it's not like when you start your case, then your 8 minute inside will be started. So everything that's happening, the time is there. So 10 minutes has started from the first bell when you started reading the case. So 2 minutes outside reading and 8 minutes is for your task. That's 10 minutes. And each of the station will be like this 10 minutes. After the 10 minutes, there will be another bell indicating that you need to leave the room. Whatever you have done, doesn't matter if you were able to finish the task or not. Once you hear the bell, the third or final bell, you need to leave the room. Otherwise, they're going to be really, really crazy on you. Okay? All right. So we will come into this like our course later on. Let's talk about the exam structures and all. So exam has 16 stations. Out of the 16 stations, 14 stations are scored stations and 2 stations are pilot. Just like your MCQ exam, you don't know which one is scored and which one is non-scored. So every case is equally important for you. Now, out of these 14 scored station, if you pass only 9, you can pass the exam. It's not that difficult. If you see the number, you can do a lot worse, but still you can pass the exam because you only need 9 stations to pass the exam. But you know that just a couple of years ago, we had to pass 10 stations, but now it has reduced to 9. But don't be too happy because with the 9 stations, they made the clinical exam really difficult. So it's not that easy. It is, they have made it difficult, and that's why they made, because people were not passing the exam. It was so difficult that almost everyone was failing. So in that case, AMC had to reduce the amount of past test score. Okay. Nowadays, it is not that bad with 9 out of 14. It is possible. So we already mentioned that the clinical examination structure is the each station is 10 minutes, 2 minutes is the reading time, which is the outside, and 8 minutes is your assessment time. So how you are going to be assessed. So the all stations are going to assess your clinical skills related to medicine, surgery, pediatrics, gynae and obstetrics, and psychiatry. So these are your main case distribution. So ideally, out of 16 cases, we see that medicine and surgery gets the highest number of cases, so around 5 to 6. There is no specific set amount that this is going to be, usually 5 to 6. Pediatrics 2 to 3. Gynae ops usually 2 or max 3. Psychiatry 2 to 3. And physical examination stations are 3 to 4. So this is how your clinical exam, the cases will be distributed. Okay. Now, if we come here, each station, the 16 stations that we're talking about, each station can have these 4 main predominant assessment areas. These predominant assessment areas can be history taking, physical examination, diagnosis, differential diagnosis, and management. So these are usually your task. Your task is always like this: history, physical exam, diagnosis, management. Sometimes the amount of task will be different. Sometimes they will not ask you to examine. They will just ask you to take history and give the diagnosis. So number of tasks will be different each station, but these 4 tasks are always there. Okay. So let's talk about the question structure and how the different tasks can appear in your exam. When you see a case in that computer outside, the first thing that you do that is this is a physical examination station or is this a full station? What do I mean by physical examination station or a full station? A full station is something like this. It has history, physical examination from examiner, diagnosis, management, everything. That is a full station. There is a physical examination station. Now, understand there are 2 terms that we use in clinical preparation. One is physical examination on the patient. So, physical examination on the patient, and another is physical examination from examiner. This is quite different. So, physical examination on the patient is something that you will need to do on the patient, and you need to find out the findings by your examination skill. Those are called P station. And P station is one of the most important thing to pass the exam because everyone will get at least 3 to 4 P station. And P station are difficult because you need to perform examination on a person. You need to find out the findings from them. So it requires a lot of practice. First aid AMC, we have 1 month of online physical examinations. So we show everything on the Zoom session, like how we're doing today, how to do the physical examination. And then our students can also join 3 days of workshop, which happens live face to face. And we are planning to do that face-to-face workshop in the next year in all the major cities. So Brisbane, Melbourne, and Sydney. All of these three cities, there will be physical examination workshop next year. So you'll be able to join our 3 days symposium where you can learn how to do this examination on a person, on a mannequin. Okay, these are super helpful. So this kind of physical examination task are just doing a physical examination on a patient for 7 minutes and give the diagnosis and differential either to the patient or to the examiner. So there is a P station, and this one, which is physical examination from examiner, it is a bit different. You don't do the physical examination on the patient. You just ask the findings from the examiner. Like you ask the examiner, I would like to know the patient's vitals, such as I would like to know the blood pressure and pulse rate. Then examiner will give you the finding. So you ask the examiner what you are actually doing, what kind of findings you're looking for. Like you want to know the cardiovascular examination, examiner will then give it to you. So you don't do it on a person, but you get the finding from examiner. These are the full station where you need to take a history, you need to ask physical examination, finding from examiner, you need to give diagnosis, management. Okay? So the first thing that you do is to decide, is it a physical examination station or is it a full station? So we know from this question, it is a full station, right? 30-year-old female presents with sudden onset shortness of breath since last night. So these are all the tasks. It's always important, guys, that when you have that 2 minute outside, you should always read the task. You should always know everything about that patient. So when we read a question, we read like this. It's a 30-year-old. It's a female. Where we are, is it in the emergency department or is it in a GP setting? Both of these setting can come in the exam, and the management is different based on the setting. And what is the actual presentation? Sudden onset of shortness of breath. So this is how you know. In your head, this is what you do. So 30-year-old, it's a female coming to the emergency with the acute shortness of breath. So I know it is an acute shortness of breath cluster. So we do the acute shortness of breath cluster in the course in the respiratory topic. So you just remember everything that what I have to do in the history because I know the cluster. So first is history from the patient. So you'll take history. Always remember the task. Not every station will have 5 or 4 tasks. Some will only have 1 or 2. If you do extra, they are not going to give you extra mark. They might even fail you because you did extra. Okay? So you always stick to your task. If something is not asked, like this case, they asked history and diagnosis. But what you have done after history, you went to the examiner and you started asking the findings. Examiner will be very annoyed at you because you did not read your task. Okay? So knowing your task is vital for the exam because you will be marked on this task. It's also important to know that history from the patient, physical examination from the examiner, investigation from examiner and explain to the examiner. That means you need to know who you're going to talk. Sometimes it could be ask investigation from examiner and explain it to the patient. But what you have done, you explained it to the examiner. That means they can't actually mark you because you did it wrong. Okay? So knowing that where you're going to talk, who you're going to talk to, it's also important because they can only mark you if you are sticking to the task. Give diagnosis and differential to the patient and management to the patient. Sometimes management can be to the examiner also. So task is really important to know. You'll be given the same question inside the station as well. So if you forget the task, you'll be able to see the task again. Now, remember one thing that there is no timer inside the exam room. This is where it becomes very complex, very difficult because you don't know how much time you have left with. And you might ask me that, so how do I know that how much time I have got left? You don't know. It comes with practice. Once you do a lot of role play with your study partner, once you practice a lot, you will know when you're going to run out of time. Every one of us had to do this. Every one of us felt really difficult because this is actually difficult not to know the time and then just blindly do this task in time. I don't know why they do that. They could just give us the timer in the exam, but they need to make it difficult, I guess. That's why they're very fussy about this timing. So there is no timer, there is no watch, nothing is there, and you just need to make sure that you finish the task in 8 minutes. And it will happen. You will be able to do that once you start doing a lot of role play with us or with your study partners. Okay? So now you're getting a bit of an idea about the task. Now, there will be a pen and paper in each station where you can write down important things. If you feel like I can't remember what patients are saying to me, I need to at least remember the name of the patient. So when you go into the station, you can write down the name of the patient on the paper. That is fine. A lot of candidates ask me that, can I write everything that the patient is saying to me? I always say no. The reason is that you already don't have enough time to even finish this task in time. 8 minutes is not enough to do 4 or 5 tasks. So if you write down everything, the chance is that you will run out of time in the middle of your task and you will not pass the station. So writing down everything is actually just going to waste your time. Okay, so please do not do that. Same thing, how to remember task is by doing a lot of role play, you will have that idea that it just happens. Like somehow our brain can remember those kind of things during a stressful time. So when you do a lot of role play, in the 2 minute time, you always think. So let's say you have got this case in the exam, 30-year-old coming with sudden onset of shortness of breath since last night. Task is history from the patient, give the diagnosis and differential to the patient. So what you are going to do? We know that each station has 10 minutes. Outside 2 minutes, first we are going to read the question very fast. And then we focus on the key point. The key points in this case is 30-year-old female, emergency department, sudden onset of shortness of breath. Know your task. Task is history and diagnosis differential. Then you start brainstorming. Brainstorming is what you will make you remember everything in that 8 minute. Brainstorm is I've got a 30-year-old with acute shortness of breath. So let's remember the acute shortness of breath cluster. So this is what you're thinking in your head. So I'm going to go in, I'm going to greet with my patient. I'll make sure patient is vitally stable, and then I will start the shortness of breath question. So after that, I have multiple differential diagnosis. I will ask cardiac questions, respiratory questions. I will make sure there is no psychiatric issues going on, and then I will finish with the case. Then I'm going to give the diagnosis and differential. So see that this is what you are doing in your head in the 2 minute time. When you do that, you already know the task in your brain. You have registered those tasks in your brain just by doing this brainstorming. And if you don't do that, then you will not be able to remember the task and you'll just say everything. Although there will be a usually the task is usually given on your in the exam room as well. So if you forget, you can always look at the task. Okay. But I have seen, like even in my exam, I could not find out the exam question or the task anywhere because I couldn't find out. There was no table, nothing. So sometimes they might not have anything inside the room and it can become very tricky. So my advice for you is to always brainstorm in that 2 minute time. Remember as many differential diagnoses as you can. It's really important that you remember as many differential because there is nothing important than asking a lot of differential diagnoses in the exam. So if you ask me how many differential diagnoses, I will say as many as you can. And in each cluster that we are going to cover, cluster will give you like 10, 15 differential diagnoses. Out of them, at least the most important ones you have to remember. There is no shortcut of that. Okay? An exam will always pass you if you are a candidate who is asking a lot of relevant differential diagnosis. It's not about irrelevant, like you can't ask everything that you want. It has to be relevant to that particular case. Okay? So I'm just going to show you how many tasks we can have. So this is a case where you have got only two tasks. So how you are going to manage the time? History, you'll get 6 minutes. Diagnosis and differential, 2 minutes, right? So that's how you're going to think that I have got a lot of time just to ask the history. So the history will be detailed in this patient. When we have got three tasks, the same question, but the tasks are history, physical exam from examiner, diagnosis and differential to the patient. Then you can't ask 6 minute history anymore. Okay? So in that case, it will become a 4 minute history, 2 minute physical exam, 2 minute diagnosis and differential. Okay? If you take a little bit more history, then you need to cut short this one and this one. But that's how you will need to think. That means you will not be able to ask a lot of questions in that case anymore. Because in here, the examiner would like you to ask everything related to shortness of breath. But in here, examiner is not expecting you to ask everything, just the focused history, the relevant one, the most important ones. But in here, they want you to ask each and everything, the relevant, like definitely relevant, but anything that can cause acute shortness of breath, you should ask here. Like let's say this is a task, four task, and that is the most difficult one in the exam to finish. So let's say you have got a history from the patient, physical examination from examiner, diagnosis and differential to the patient, further management to the patient. Four tasks is really difficult. So in such case, the history will it will get more shorter. So 3 or 3.5 minutes. Physical exam 1 to 1.5. Diagnosis max 1 minute. Management 2 minutes. So you can say that as the number of tasks increases, the amount of time that you can give to each task that will also get reduced. And that is the way to manage time. You need to know how much task you have got to cover. And based on that, you need to change your history taking. You need to change your physical examination. And that's the smartest way to do. And people who can do that, they are the one who pass the exam. Okay? So I can see a few of you have written some questions. So yes, Monica, you will have a pen and paper in front of you. Adrish, as I mentioned, how to remember the task. Can we write down the task on the paper? Yes, you can. You can write anything that you want in that 8 minute time. You will not be able to write anything in the 2 minute outside. So they don't give you a pen and paper in the outside. Only inside that 8 minute time, you can write anything you like. Yes, the inside 8 minute will also include introducing yourself to the examiner. So you will never get full 8 minute. You will get maximum 7.5 minute or maybe 7:50 minute, 7 minute 50 second. That's the max that you can get. And BB, there is no timer. If a patient is explaining a lot, they are actually trying to sabotage your exam. In that case, you can always interrupt them and start asking relevant questions to them. So there is an art as well, how to stop a patient who is explaining a lot, but also not making them feel bad. You can't just tell them that don't talk too much. You have to just know how to cut them out and start asking questions which is relevant for you. Like someone is blabbing a lot and lot about their lifestyle and all, you will just immediately say, well, Sam, I understand that you have got shortness of breath. Could you tell me a little bit more about that? So you just come back to the track by asking the questions that you want to know. Okay, so this is the smart way. You can't hurt someone, especially for Australian health system. You can't just say someone that don't talk too much, don't like just answer my questions. Don't say that. You will fail the exam immediately. So you just need to be patient with them, but always you can bring them back on track. You are the boss always. So you can't show it to them, but you are always the boss in that room. You need to pass 9 out of 14 station, not 16. No, passing a score doesn't depend on the performance of the 16 candidate on that day. There is a specific criteria of passing a candidate. There might be a day where no students have passed. It can be. So we are actually on that topic at the moment that how AMC mark a candidate. In each station, the examiner is required to determine a global rating for that station. So there is always a global rating for each station. The station result depends on key steps related to that station. So there is every case that you are going to do in the exam, they usually have 3 to 5 key steps. That means those steps you can't miss. There are always a relevant assessment domains for each station. So every station has a predominant assessment area. Some station might focus on how you take history. Some station will focus how you do management and counseling. How the physical examination station will focus on your accuracy of physical examination. So there is always a specific assessment domain, and that domain will be the most important part of your case. Like a case where we have done, like this case, sudden onset of shortness of breath since last night, like this particular case, what do you think is the most important assessment domain in here? Like if you are an examiner, what should be the assessment domain in here? Is it the history? Is it the physical examination or diagnosis and differential? So where an examiner will focus more. So where an examiner focus more is what we call predominant assessment area. In this case, the history taking is the most important thing because without a proper history, you can't make the diagnosis. Okay, so this is a case where history taking will be the predominant assessment area. So in several ways, there are different predominant assessment area, like a case where patient has been diagnosed with prostate cancer. You have to take history and also you will need to counsel the patient. In a prostate cancer or any cancer breaking bad news, the predominant assessment area will be the counseling. How you're doing the counseling will be the main thing that going to be focused. Okay, so a smart candidate also know that which task is the most important task here, and they focus more on that particular task. Okay. And also, the result will be based on an assessment of the overall performance of the candidate in that station. So it's not that if you did not do something, if you miss one key step, that they're going to fail you that station. It's not like that. It's about your overall performance and by the end of the day. The content of the clinical exam. The scenarios used in the assessed station will be a clinical STEM, a series of tasks, and a suggested timing for the main task. So many times, the main task in the exam will have a time on it. Like they will say, take history for 4 minutes. If you say some, if you see that a task has a specific time, think that this is most likely the predominant assessment area. That's pretty much always the case. Okay, so it's not always that they will give you the timer like history for 4 minutes, but sometimes they do. If there is a task where they write the timer history for 4 minutes, what happens in the exam that after 4 minutes you get a bell, and that's the bell of 4 minutes. Okay, that means your history taking 4 minutes is done. Move to your next task. So as I was mentioning to you, each scenario has a single predominant assessment area. Could be history, could be physical examination, could be the diagnosis or counseling. Assessment task will be focused on this area, but it can include other areas as well. Okay. Now, during the reading time, the candidate will evaluate the given information, as we already know about this. So we also know the task. The task can be any of them. Marking in the structured clinical assessment examination. So each station has a predominant assessment area that defines the main aim of the station. The marking system contains three components. So when an examiner mark a candidate, they look at the key steps. So how many key steps you have covered in that station. The domains is that the predominant domain in that station, and the global score. Global score is the score of the overall performance of a candidate. So you might think that why I'm discussing that. I'm discussing this because you need to be smart to pass this exam. You need to know ins and out of this thing because you need to think like an examiner to pass this case. Okay, so you need to know where they're failing you. You need to know what they're actually observing you. So without knowing that, you can easily do everything right, but still you're failing the case. So we talked about the key step. Domains, we know that what could be the particular domain and the global rating. Remember, finally, the examiner makes a global rating of the candidate's overall ability on the station on a 7-point scale. So the examiner use a 7-point scale for each of the tasks that you are doing. So let's say there is a task of history taking. So you will be scored from 0 to 7 on that station, on that particular task. Then there is a task of physical examination from examiner. You will be scored in the same way. Then there is diagnosis differential, same. And then out of all of this, there will be a global score. Same global score will be between 0 to 7. If anyone get more than equal to 4 in the global score, they will pass that case. Remember, it's not an average of this task. It's the overall performance. Okay? But how you do this specific task, it will determine your global score eventually. Okay? Does it make sense, guys? Are you understanding me? Is it not very difficult? All right, great. So we talked about how the examination will be started. So you already know about this. So let's say this is a task. You are working in a general practice. Your next patient is a 37-year-old woman who suddenly became short of breath at work yesterday. Your task is to take a relevant focus history. You should not take more than 5 minutes for this task. Obtain relevant examination finding from examiner. Examiner will only give you the result of the finding that you are asking for. Remember, If you don't ask something particular in the examination finding, the examiner will not give you the finding. Explain to the patient the diagnosis and possible differential diagnosis, giving your reasons. This is exactly how the task will look like in the exam. They are very specific about the task. So this is a sample mark sheet that an examiner will have when you are performing that case. As you can see here, first there will be some key step. The key step in this case was, did the candidate inquire about history of recent travel? Why history of recent travel is important in an acute shortness of breath case? Yeah, pulmonary embolism, right? Because long flight or long travel can indicate PA. So if you haven't asked it, it will be like that. Did you measure the patient's oxygen saturation in the physical exam? Or did you ask for oxygen saturation? Because that's really important. Considered the likely diagnosis of pulmonary embolism. So you can see that each station will have this kind of 3 to 5 key steps, which are the most important part of that case. Now, we never know. So there is no way we can know that what are the key steps, but the history format or the format of the task that you will be shown in the course that will cover these key steps. We never have any trouble to get the key steps right in the exam. And then this is how you will be assessed or marked. You can see the mark is having a score of up to 7, right? So first, always every case in the exam, there is a mark of approach. So approach is really important. If you don't have a empathy or respect towards the patient, you are not listening to the patient, you are you are using a lot of medical jargon, those are not good sign and you will not pass in that approach to the patient case. So approach is must. Okay, history taking, choice and technique of examination, that is the physical examination from examiner, and diagnosis and differential. Let's say someone has got, in the approach they have got 4, history got 3, choice and technique of exam 5, diagnosis differential 5. So they passed most of the station, but the history was not enough. Okay? The key step was okay. But this is the predominant area, right? Because the history was predominant in this case. So predominant domain is really important to pass. The likely chance, even though they have, on an average, they have passed, likely chance the examiner will just give 3. Okay, so understanding the predominant domain is really important because if you don't pass the predominant domain, the chances that as a global score, they will fail you that case. But let's say you did history, you got 4, but choice and technique, you got 3. You will pass that exam. Okay, so that's how the exam marking usually works. So you need to know which is the most important task in that particular case. You should always try your best to get all the key steps, and definitely you need to finish all the task in the 8-minute time. And also your approach to the patient should be really gentle and respect. So you should always have proper respect and empathy towards the patient. So tell me, in this case, that we know that a 24-year-old uni student presents to your GP clinic due to falling grades. He has been referred by the university counselor. Take history from the patient, give your diagnosis and differential. What is the predominant domain in here? That's easy to understand because there is 2 tasks and history is definitely the predominant domain. Let's talk about this one. 30-year-old coming to the GP clinic having headache for 3 months. He has been recently promoted at work. History for 4 minutes, physical exam from examiner, diagnosis and differential. In here, the predominant area is also the history because you can see they have given a specific time. So there is a cheat sheet in the exam that if there is a specific time, that is likely to be the predominant assessment area. Same case, patient have headache for 3 months. History, physical exam, diagnosis, management. In this case, it is difficult to know that what's going to be the predominant domain. It could be the history, it could be the management. But usually, without a proper history, you can't manage a patient. So history is still going to be the predominant area. Okay? So so now tell me this one. A 50-year-old male presented to you with a chest pain 30 minutes ago. ECG is given, and with the ECG, it's an acute MI. You are in a rural hospital. The nearest tertiary hospital is 4 hours away, and you have no option of transferring the patient. Take brief history, ECG to the examiner, and explain management with the patient. What is the predominant area in here? Now, this is a case where management is the predominant area. Now you are getting the hang of it, right? Like just by reading the question, you know that this case I need to focus on the management, or this case I need to focus mainly on the history. And that's really important because then you can make a bit of a sense in your head that I need to focus here more on the management. So I'll take a very short history. I'll not waste a lot of time. This case where a middle-aged patient presents to the emergency department with a sudden onset spinning sensation and unsteady gait, also having disturbing sensation in the air. Perform a relevant physical examination on the patient, diagnosis and differential with the examiner. So this is a case where you have to do physical exam. So what is the predominant assessment? For physical examination cases, predominant is always physical exam, okay? Because that's what they're going to look. So that's pretty much everything you guys need to know for, for the marking of AMC clinical cases. And now you are pro to start your preparation. Do you guys have any questions so far, especially about how the AMC clinical exam is going to be? And you can unmute yourself and ask questions if you like. Do we need to read the entire AMC clinical book? AMC clinical handbook is important. There are 150 pages there, which every candidate needs to read at least once or twice. So there is a soft copy which we will provide from the course. And that is the only book that you will need to read just to understand the cages and understand the key steps and all. Apart from that 150 cages, that AMC clinical handbook, you don't need anything else. The course will provide everything. The course, our course have a very detailed notes on almost anything that can appear in the exam, and that will be more than enough. And the notes are updated according to the therapeutic guideline that we follow in Australia. So all the notes, it is prepared by me, and I have made sure that I went to the therapeutic guideline and made sure anything that is currently in the guideline will be taught in your course as well. Okay? How much time you need to be prepared? Clinical exam preparation is a bit more difficult. So 6 to 8 months of preparation is must. Some might require 8 to 10 months based on how fast you can learn. These are all acting. So these patients are not real patients. These are all simulated patients. Yes, there are separate handbook for clinical. So just like your MCQ handbook, there is a handbook for clinical exam as well. There is no need of Telio Corner. The, the, the one that we are going to, so we will show you the physical examination based on the guideline that we follow in Australia. That will be enough. Telio Corner is not needed at all. Just a waste of time. The emergency situation cages with mannequin. So you don't get those kind of emergency situation where you need to show the patient, show the examiner how to do ALS, BLS. Those do not come in exam. The course material, so once you enroll into the course, the materials will be available. So everyone will be given access to the course from 1st of January. So, and also the previous batch recordings, you only get those once you make the full payment. So if you make the full payment, then from 1st of January, you'll be able to access all of our previous batch recorded class as well. So if any of you are going for the exam in early few months of the year, like March, April, then my suggestion will be to get enrolled into the course. And from 1st of January, you'll get the full access to our recently finished course where we have discussed like a lot of things. And that is more than enough for you to pass that exam. Okay. The copy of the
Hi,
clinical book will be given into the course. Do we
uh,
need to, yeah, ask, sorry, who was going to ask?
I'm sorry. Hi, doctor. Nice to meet you. I hope you're doing good.
Yeah, I'm good.
So,
Pratik, you just passed your MCQ exam?
yes, doctor, last May I passed with your
Yeah,
MCQ course.
yeah, I remember your name.
Yeah, so doctor, so in when I was making the payment for this clinical examination, there was a segment for like if you are a past student, you have to enter the email. So it is for the past clinical or any past student.
Didn't get it. Is it for like the main clinical exam or for the course?
For the course, for the course,
Okay.
there is a segment like you have to enter your email and you have to either write your name and we'll check and send you a coupon or something like that. If you are a past student, there is a segment there in the
Uh,
payment
That's
page.
not for, that's for only like that, that's not for you guys. So it's not the past students, it's about the, like there are clinical students who did our course before and they want to re-enroll. So it's for past clinical students, not for other students. Okay. So you'll know, you don't need to do that. You will not get those coupon anyway. So just don't do that part.
Okay, thank you.
Okay. Thank you. So, other questions? So, where can I have the copy of the clinical book? Augustine will give that to you in the course. Do we need to study physical exam from Telio Corner? No need at all. I will show you the physical examination, everything. That will be more than enough. Examination questions will be as lengthy. Yes, these some questions are lengthy, some are not. So it's a combination of both. How can we get finding by examination if all are acting? So good question, Roy. So sometimes you do some exam, like you are doing a knee examination, and definitely you will not get swelling or you will not get like tenderness or something like that, or you will not get any, most of the findings you will not get in a simulated patient. What happens in that case that when you do that particular exam, then examiner will give you the finding. Examiner will say that yes, there is a swelling in the right knee. So the findings that is not possible to reproduce in a simulated patient, it will be given by the examiner. Yes, Roy, there is a portal. So just like your MCQ exam preparation, our clinical exam, the portal is going to be the more or less the same style. And if you have done our recent MCQ batch, you know that there is a new portal that we have, and the new portal is super good. It's well designed and structured, and it's really a good portal that we have done at the moment. So there will be everything there separately addressed. So there will be theory-based discussion in one section. There will be recall-based discussion. So it's very well structured. Yes, Sajan, to get full access to the course material, you will need full payment. There is an installment available, but with the installment, you don't get the full access. Karen notes, Marwan note, not needed at all. Those notes are not updated. Those notes are full of mistakes. So please do not go into those notes anymore. Our notes are more than enough because these are all updated at the moment. There is no discount for MCQ courses student. All like usually our clinical course, it is already we made it in a discounted price. If you do any clinical course which is registered in Australia, you will find no course less than $4,000. So the courses that is run by same doctors like us, those courses are costing everyone as more than $4,000. Where this course that we are giving with more duration, so the courses that is taking $4,000, $5,000, their course is only 2 months duration and our course is 5 months duration. There is a lot of classes that we take, and still it has the most affordable course fee out of anyone in Australia. And we are certified learning provider according to under the Australian Medical Association. And with any certified learning provider, you will never get any course which is able to provide such such materials with this payment. So it's already given in a discounted price because I am an IMG just like you, and I will never do a business with my own people. I want you guys to get the best preparation and pass this exam and start being a doctor in Australia. But again, I also need to like give a lot of my time, my family sacrifice for these classes that we take. I could go out with my wife and go for a dinner date, but I'm taking classes. So definitely that requires a payment, and also we need to pay a lot of taxes. We need to pay our mentors. So the course fee that we are taking from you guys, that's minimum according to the Australian standard that we follow. I hope you guys understand that. Okay, so as you guys are asking about some of the questions related to the course, let me discuss about the course in detail. Okay, so first of all, I want you to know that we are under AMA, we are official certified CPD home providers. So we contribute, our course is a part of accredited CPD course provider. So both MCQ and the clinical course, along with the pesky course that we provide, are accredited according to Australian Medical Association, the CPD Home. So if you enroll into the course, there are options where you can add a CPD certificate under us as well, because we can provide CPD certificate from the course as well, because we are also an accredited course here. So, but there are different subscription fee for that because we also need to pay a lot to become a CPD home provider. Now, because you should know about the course in detail before you enroll in there. So let me discuss about the course, and if we get some time, we will start the psychiatry. So first aid AMC clinical course, as I mentioned earlier, that the course is not a new course. It's not run by someone amateur, someone new in here. So it's been here, it's been guiding IMGs for a long, long time. And we changed our approach, we changed our guideline notes, everything based on how AMC has changed. Because since it has become a 9 station out of 14, AMC has become more difficult. It has changed its way of marking. It has changed a lot. So in the same way, I have made sure that the course also changed and evolved so that our students can pass the exam just like before. The new course is a 5 months course, which is going to start from 7th of January. And our 2 weeks free session will also start from 7th of January. So the 2 weeks free sessions, we try to cover lots of topics over there. So we'll do some role play classes on psychiatry. We'll do full cardiology with you on that trial class. And also you'll get to know a lot of our role play mentors. They will do random role play with you as well. So the schedule of those 2 weeks free session will be provided to you, and that will be given in our Facebook group. Now, before you do any course, especially clinical course, because clinical course, first clinical exam is quite expensive. You don't want to reappear this exam because it hurts in multiple ways. It hurts your wallet, it hurts your heart. So you have to be well prepared before you go for this exam. And when you choose a course, that should be your only course that you need for this preparation. And I can assure you that this is the only course that you will need for passing the exam. So do our 2 weeks free session, learn if this is a course that can be helpful for you. And if you feel that this is the right course, you are understanding us, you are learning a lot of things, then only join. Do not just join a course just by learning from others or just by learning from other students who is saying something different. Just come and do our role play, our 2 week session, and if you find it is good, then only join. The course fee, there are 4 subscription fee for the course. So depending on the access, so we have 10 months and 15 months access for the course. There are CPD certificate, no CPD certificate. So there are multiple subscription fee there in the website. And this is our website where you can go and have a look at it. The the lowest amount is 999 Australian dollar. So with 1,000 Australian dollar, there are no course in Australia who is a registered course will be able to provide a 5 months clinical course. It's not possible, but we try our best to provide it. Course details. So course has everything well structured so that you don't need to go anywhere. We will cover the full theory based on all the topics, and we do it like a cluster wise. When we do the free 2 week session, you will see what do I mean by this cluster based approach. You'll get to know 3 year recent cases. So all the past 3 year cases, it's already will be given to your portal, and we will do the recent cases role play in the course. Nowadays, we only do face-to-face physical examination. We don't do online format anymore because online exam is not there anymore. So physical examination is really important, and many of our students have that idea, or many of you have that idea that how an online course can be helpful for a face-to-face physical exam. As I said, that all the physical examination will be shown to you over the video. So over the video, you'll be able to see all of them. And all you need to do is to practice on a person in your own home. But if you still feel that, no, I'm lacking because I can't do it on a mannequin, which sometimes can be there in your exam, we have all the mannequins that can possibly be given in your exam. And you can always join our face-to-face workshop, which is the 3-day workshop where you can practice on the mannequin. You can even practice on a person to get to learn about this physical exam. So if you are thinking of joining any face-to-face course, like you want to go there and do the course, it is absolutely not necessary, because the only thing that is really needed, that's the physical examination. Everything else can be done online. And the physical examination part, one, with online session of 1 month physical exam, that is more than enough to learn about physical exam cases. But still, if someone feels, no, it's not enough, we have got the face-to-face workshop, which will be running throughout this next 1 year. Okay, so next year we will have at least 3 to 4 workshops in different cities in Australia. We also take some mini mock exam in the course so that you understand how the exam is going to be. We do role play of almost every cases that is important for exam. So we have at the moment we have three role play mentors who do role play with students based on the important cases. And we have like 3 class in a week. Sometimes it's going to be 4 class in a week. 2 class is for theory, and 1 or 2 class per week will be on role play. So we focus on both theory and the role play so that you are well practiced. You should know how to do role play with your study partner, and you need to do it in your own time as well. There is nothing important than doing a lot of role play with your study partner for passing this exam. As part of the course, you will get full notes and the class recordings in the portal. So a student portal will have full notes and the recordings of the class. If you have purchased our 10 months access, then the class recordings will be there for total 10 months. We don't delete our class recordings after 1 or 2 days. A lot of courses do that, so be very careful because you might need to buy a course multiple times before you can go for the exam, because there are a lot of courses who will just give you 2 days or 2 days of access to their particular class recording, or maybe 1 month of class recording. And that is not enough because you need to come back to these classes again before your exam. And having a 10 or 15 months recording access, that's going to be the most cost effective way to learn, or cost effective way to get into a course. If a course cannot give you those recordings for an extended period, it's not going to be helpful. Okay, because if you have passed MCQ, especially from our course, you know how those recordings can be helpful for you, because you can always come back and you can just learn about them. And many of you will not be able to do live classes. And having this offline recording access will give you a lot of flexibility, which is really important because for any doctor, it is not possible to give like 30 days of finishing a topic. Like if I ask you that I'm going to give you 30 days of access just to finish medicine, I know that 70% of you will not be able to achieve that because it's not actually possible. What they are doing is that they are doing a business where you are paying for that 30 days of recording, and again after a couple of months you are buying it again and again and again. So it just continues until you pass the exam. So please be very careful about these kind of things. Now, in your course, we have started two new things. One is a one-to-one role play with our mentors. So we have some specific mentors who can do one-to-one role play. And that has some specific subscription fee. That's not a part of the course, but with some minimal subscription fee, you will be able to do one-to-one role play and get a good feedback from our mentors that what you're doing wrong. There are also one-to-one job search meeting with our mentors. So you'll be able to get into those sessions where you can learn about how to apply for jobs. Okay. So this too is not a part of the course, but as a student of the course, you will get a lot of discount to get into that sessions. If you finish everything that our course gives, you will be able to achieve 130 CPD hours for the next year, which is a lot for your CPD requirement for this year. Okay, so CPD only requires 50 CPD point per year, and you can get like 130 from our course. Now, if you want to enroll into the course, you have to go to this website. So I'm going to just show you the website, how it's going to look like. So if you just write firstaidamc.com.au, then this will come up. So just write firstaidamc.com.au. There is a previous website that we have, so don't go to that website because that website is no longer valid for us. This is a new portal that we have created. So when you go to the First Aid AMC website, you will find out the extensive clinical course session over here. So if you go to the check info, you can also read the full course detail here. Okay. So if you look over here, you can see that everything that this course is going to give you, it's all written in here. As I mentioned, the theory based on clusters, role play of recent and past cases. You will also get recent 5 years sample questions. That means all the last 5 years cases that is important for your exam. The role play that we have done with our students, those role play sessions, videos, and the notes are already given. Now, there is an extensive amount of discussion. There are no courses in Australia who gives past recordings of their last 5 years classes. And I can guarantee that. What happens with this kind of extensive discussion materials that if you have time, you can go back and learn about the important cases and you can listen to the role plays and you can understand how the students are doing the role play and you can learn from them as well. And in here we have like more than 300 to 400 cases that we have discussed. Okay, there is a lot of things to get from a course, and we don't ask for any other payment for this. Physical exam, online mock, we already discussed. Recordings, we discussed. So you already know that. You will get a certificate as well. Remember, if you can't have 5 months for your preparation, it is still a good idea to join the course. The reason is that we give access to our last batch to you guys as well. So the last batch that we have finished, all the classes that we have taken with them, it will be given to your course as well. So you can always go through them and finish your course within 1 or 2 months. All of our teachers or mentors, as I mentioned, they passed their exam. They are working in Australian health system for a long time. And you'll be able to see these 4 different subscription options. You can give it a read in your own time. For registration, you just need to click on this register now button. Once you click over there, you will need to enter your email address here and then click here to send a one-time password to your email. So check your email, you will find out a password there. You need to just insert that password here and then submit. Then one by one, the portal will ask some of your personal information, which is your name and everything. You will need to upload documents of these are the documents for verification, which any Australian course will require. So either your driver license or passport, and also a document of your AMC portal showing that you are eligible for AMC clinical exam. And then with any card which you can use for online payment, you can use that for making the payment in here. Okay, so that's basically how to enroll into the course. So I guess you guys have a lot of questions, so you can ask questions now. I believe we will keep this class tonight as just a interactive session and question and answer session instead of going into the full-blown psychiatric class. We will do the psychiatry class in our trial session, and that way it will be much easier on you. I don't want to burden you with a lot of information in one class. So you have all the time to ask any questions that you want.
Hello, sir.
Yeah.
Good evening, sir.
Good evening,
Sir,
Mahesh.
just I want to ask when the next scheduled date for the clinical exam to book for the clinical exam is going to have open. Can you please give some information about that?
All right. So if you go into the amc.org.au, that's where you can find all this information. So let's have a look. So in here, you have got the clinical exam specification. So read the examination specification. It's really important to know. So you can see here, clinical exam scheduling update. So February to April. So this is where you will find out that as we have been able to identify the F, we will no longer, okay, so that's not the case. So this is where, excuse me. So this is where they will usually write that when your exam, the next one, the exam schedule will be open for registration. No one knows before that. So what we can only say that you will need to just keep an eye on this AMC website that when the next one will be open for enrollment. So February to April, it's been already scheduled. It's been already closed for registration. But the next one, the May, June, and July, that's probably it will open early next year. So January or February, when that will be open for enrollment. Okay.
Thank you, sir. Okay.
Hi,
Thank
Dr.
you.
Ashan.
Yeah.
Hi, okay. I just want to make a clarification that once we pay the full payment, how early can we get the access to the portal?
So everyone doesn't mean when you are going to pay for the course, everyone's access is set from 1st of January. So you will get the access from 1st of January.
Because in the previous videos, I saw that I noted that once you pay the full payment, you will get the access as soon as you full.
It's no longer the case because the portal has been fully changed. So the new portal only gives access one at a time to everyone.
And okay, thank you so much.
Thank you.
And the one question, Doc, what are the scheduled for the physical examination workshop in the different cities?
We haven't scheduled any of those dates yet, so that will be given from in January because we still are finding out it based on the students that we get enrolled in the course. Then we decide which cities we will go for the physical examination workshop based on the number of students in each cities.
Because I'm enrolled for the exam in the April, so that's why I'm asking that we can do it
Yeah.
3 days, yeah, if it's possible.
Okay, we'll have a look at it, Dr. Sarjan. We can't be fully sure yet about when it's going to be, but definitely there should be one before April.
Okay, thank you.
Thank you. Okay, so let me go through some of your other questions. So, is the 3-day workshop included in the course? No, it's not included in the course. There is a subscription fee for that. But as part of the course inclusion, you get 1 month of physical examination class. So the course will have 1 month of physical examination class online. Yes.
Hello,
All
sir.
right. Yes.
I just wanted to ask regarding the previous online clinical course versus current face-to-face course content. So, is there any changes or is there any different content compared to the previous online class content versus now? So,
Yes. Sanjay, that's a very important question. It has been changed a lot. It just because the online, there are different cases that used to come in online setting. And for face-to-face, it's quite different. This year, solely this year, there has been a lot of cases which is quite new, and there is nothing similar to face-to-face online exam. So there are definitely changes from online and face-to-face cases as well. And on the top of that, the physical examination is fully different from online and face-to-face. So online physical exam preparation and face-to-face physical exam preparation is 100% different. Okay. So if you have done online preparation, I would definitely suggest to enroll into the face-to-face one.
thank you so much, sir. Thank you, sir.
Thank you. Augustine, 2 weeks free session is a part of the 5 months course. That's right. We don't have any app. You get access from the web page. That's right. Part, I'm not still sure that if Charles, if we are going to have any, it depends on the number of students. If we get a lot of students from Perth, then we might include that, but otherwise unlikely.
So this class will be
Okay.
right, sir?
Yes,
The classes will be 3 days in a week. Am I right?
3 days in a week. Yes, that's right. And the classes start from 8:30 p.m. Sydney time, like how we have done today, and it will finish at 10:30 p.m. So 2 hours class. Yes, all Dr. Sayuri, all the class are recorded classes. So if any of you can't join the live session, those classes will be recorded always, and it will be given to the portal.
Yes, Dr. Arshan. The physical examination 1 month on it should be before this exams dates, or it will, I don't know what is the schedule for that.
Physical examination, usually we do it in after 2 months of the course. So if we are starting it in January, so February, March. So early March, we will have the physical examination online class.
Oh, thank you. And do have the previous one
Yeah.
on we can do that?
Yeah, so if you're going for April, then I will ask you to go into the previous one because that will be important for you.
Yeah, that's it. That's what I was thinking. Thank you.
Yeah. Okay, thank
So,
you.
sir, is there any chance of conducting any face-to-face, like clinical, I mean, physical examination in Perth, sir? Why don't you
Uh,
consider? Because most of the students are based in Perth, I think.
Okay, that is we will actually have to have a look at it after we get the full student number, and then we will have a look at it because most of the time it will be we know that it's gonna be in Brisbane, Melbourne, and Sydney, but the Perth and Adelaide we will see if we can add that. It depends, but if we get a lot of students from Perth, then yes, why not?
That would be great, sir.
Okay, no worries. Thank you.
Hi, sir.
Yes, Adrish.
I just wanted to ask how much time will be required to prepare for the exam because I recently cleared in the November attempt. So I just wanted to start as early as possible. So
Yeah.
how much minimum time will be required for that?
8 months, Sadrish. If you go for like with good confidence, at least take 8 months. That will be my advice.
All right. And this exam is conducted around a year or
Yeah,
in only specific months?
around the year, they don't have exam in December, January, and sometimes in November. So definitely not in December and January, just like the MCQ.
All right. Thank you so much.
And Rodrigo, is it must to practice with a study partner? Yes, it is must. Without practicing with a study partner, it's unlikely that anyone will pass the exam. Now, if you say that there are students who passed without doing a single role play, I have got students like that, and I don't know how they have done it, but to my experience, without doing role plays with a partner, I don't see how they have passed it. Okay, they must be really good, or they might have practiced like in front of a mirror, something they have done, but definitely you need to practice this with a partner. Without that, it's difficult to even manage the time. Will we get a CPD certificate? If you purchase the CPD subscription option, then yes, you will get it. You can't register to a CPD home without a registration. So if you go for a CPD home like RSCGP, then it will be they have an option of international medical graduates for a CPD home. So you should be able to get into there.
And sir,
Uh,
can you please guide a little bit about jobs offers after AMC 1?
we will have a course on it, like a class on it. So today we are not going to into that because it is a lot of things to discuss. So we always do a class on registration pathways, usually in the first 2 weeks of free session. So you will get that class as well, like how to start looking for the job, what are the things that you should look for. So there will be a class on that, and that is free for everyone. So we will post about that class in the Facebook group.
All right, thank you.
Thank you. Dr. Ayman, do we book exam first? No, don't book exam now. You are just a beginner, and at least you should think of booking an exam when you are at least 50% prepared. Before that, don't think about it. Same with the visa. We can't give you like guidance on visa. It's usually part of the migration agent's job. I can't help with that, but definitely you should talk to a migration agent if in this kind of scenarios. But it's not impossible to get a visa because ideally, like everyone knows that people needs to come from overseas to appear the clinical exam. So usually it is fine. How will you know about the offline workshop? We usually post about it everywhere, so you'll find it out. If you are in the Facebook group, or usually we post multiple areas, so you'll find it out, okay? Yes, it will be. So if you are registered with RACGP, then you can add our classes, and then you can add our classes in the CPD dashboard of RACGP and get the CPDs from them. It's fine. You can be a part of any CPD home and add our class there. All right. So that was all about I believe actually usually what we do in our classes, in the trial class, we try to start the psychiatry as well. But I believe that sometimes what happens, students gets too much information in the first class and they get really scared about the class and course. So I didn't want to scare you out. So follow us in the first 2 weeks of the free class and start learning about the course, and I'm sure you will enjoy the class. And after that, you can always enroll into the course. If you want to enroll before the trial classes, then there are lots of previous trial classes that we have taken. You can always go into our YouTube and watch those videos if you want to get some ideas. Yes, Piomi, if your exam is in May, you will be able to participate. Yeah, why not? Clinical handbook is still updated. So I know that this is quite a long time ago that has been prepared, but it's still everyone read the clinical handbook, and you should also do that. The Facebook group that I am talking about, so if you haven't been part of our Facebook group, then you should join the Facebook group. So let's have a look. So this is the Facebook group for First Aid AMC Clinical. So if you just write First Aid AMC Clinical, you should be able to see like all the posts about the course. Usually we give it in here. Okay. Now, the one thing I wanted to discuss with you is how the first aid course is different from any other courses that you will ever come across in Australia. So there is definitely a difference, and that's why our student passed the exam in our first attempt. So the difference that we say is that definitely we provide extensive detailed notes for each topic that is important. There are lots of courses where they will not provide the note to you because they just want to do business. and you will need to write notes in the class. Now remember that if you need to write notes in the class and you also need to listen to the mentor, and you need to write notes about 300 400 pages, how exhausting that can be. So we always advise you that if a course is not giving you the notes, because it is important to get some notes so that your preparation can be easier. Because writing notes and then again updating them, it takes a lot of time to prepare for the exam. So it's really important to have a course who can give you extensive updated notes so that you can just read the note and at least save a lot of the time on your preparation. Because by the end of the day, when you come to read that note that you have written in the class, most of the time you will not be able to write everything. And most of the time, if you focus on writing the note in the class, you will not understand anything that the mentor is saying to you. So it is not the best way of taking a course, of not giving the notes to the students, because you are paying for the course. So we make sure that you can save enough time with everything in place in the student portal. Extended class recordings with no restricted hours to watch the video. There are courses where you get very limited recordings with restricted hours. So they give you like two days to finish the video, and after that class will be gone. Our main goal for the student is to encourage the student to prepare for the exam. But there are courses where main goal is to scare the student so that they get enrolled into their course. And we get a lot of students from other courses, and they are definitely not happy with them at all, because it's not about scaring our students. It is scary already, and we don't need to scare you to come and join the course. We want you to feel motivated so that you can at least enjoy this journey with us. This is the most affordable course with everything a course can actually offer you. We don't have anything like we divide the course into multiple different sections and ask for different kind of payments. It is not like that. Once you enroll, you get everything in place, and everything that is needed, it's there. There is no specific, or like there is no multiple payments kind of things in here. We can offer CPD certificate, but there are courses which are not even accredited, and they still run courses for AMC Clinical. I know that there are courses in online courses where the mentors not even passed the clinical exam, which is really a worry for us, like how they are preparing students for clinical. I just don't know. We have extra session on role plays, and we make sure that these are designed to improve the student's approach. So you get case by case feedback from our mentors on your role play style. If you're doing something wrong, we will definitely show to you that this is wrong and you need to make it up. Okay? And many courses will not have enough role play sessions. We also do a lot of discussion about job hunting, one-to-one role plays, which most of the courses otherwise will not offer. Very important, all of our mentors are working in Australia at the moment. There are lots of mentors who just recently passed their exam, not working in Australia. They are also teaching clinical course, which is again not the ideal scenario. Remember, as I mentioned, that all the notes that you will see in the portal, especially from the last batch, all the notes are updated according to the recent therapeutic guideline. So we made sure that the notes are in the standard of the Australian health system. If you look at this slide, you will find out how many students are passing the clinical exam. And this is just one part of it. It's not the whole people. So I want to show this to you because you should see that it's not the impossible exam everyone talks about. So this is an exam where you can pass with the right guidance and with a good structure. But if you go haphazardly, if you don't have a good guidance, then it is really difficult to pass. So I will finish you with a video of the new clinical course. So let's have a look. Can you guys hear me? Oh, okay. Sorry. I think somehow you were not able to hear me. Okay, so that's it for tonight, guys. So I can see that you have some questions in here. How much we have to pay for CPD hours? So the CPD has a bit of a specific subscription fee. I can't remember from my mind. Adrish, if you go to the website, then you'll be able to see like there are different subscription options there. There is no CPD home which is actually cost effective. Ideally, every CPD home costs a lot. There is no CPD home in Australia which is less than 400. So if you think in that way, if you're going for just a CPD certificate from the course, that like our one will be the most cost effective in that sense. Okay. Yes, today's class will be uploaded in the Facebook. Today, Dr. Hogai, we will not be able to start the psychiatry tonight because we are running out of time. So it needs at least an hour to show you the basic of psychiatry. So my plan is to go for the psychiatry in the first class of the free 2-week session, and we will go from there. So Rite, the CPD is a continuous professional development. If anyone has a work gap, or let's say you're not working currently, or in 2026, you will not be working as a doctor in your country, or you're in Australia where you can't work anyway. For you, if you need a recency of practice, and these CPD points or CPD hours will at least give you some recency. That's it. So if you are going for a job application, APRA will ask you the reason of the work gap. And the only way to reduce your work gap or to fill your work gap is doing some CPD courses. Okay. So how to get it from our course address? So when you are paying the amount during the course enrollment, then just choose the CPD option. So there is subscription options there, 1, 2, 3, 4. Choose the one which has written with a CPD certificate. Pesky and AMC2 is not interchangeable, Nadisha. So if you do Pesky, it's only for general practitioner. It's not for hospital. So you can't just do a Pesky in place of AMC2. If you need to pay in two divided way, Reja, then send a message to my messenger and we will send you two different invoice. So you'll need to pay by invoice in that case. So some countries have issues with maximum payment that you can do at one time. If you are in that country, then you can ask for an invoice from us and we will send you separate invoice. Yes, Rajesh, you can ask for CPD certificate if you have enrolled for CPD certificate in our course. We don't have any face-to-face classes, Dr. Hugai, so it's all online classes. Okay? All right, so thanks for joining us tonight, and I'm sure I will meet all of you again on 7th of January, where we will have our first class. And we will start with the basic psychiatry on that class, and we'll do some role play as well. If you are interested to do a little bit of psychiatry, I will ask you to go into our YouTube. So if you just go to the YouTube and write First Aid AMC, you'll be able to go into our recently finished trial class and you can just find it out where we have done the psychiatry class. So in that way, if you want, you can start your preparation as well a little bit. Okay. Thank you all. Have a good night. Take care. Bye.